should be developed, but not at the cost of environment. We can do a lot to educate, to protect and to grow the biodiversity in the Himalayan region. Let's all join together and make this Himalayan project a big success. Himalayas are sacred to us and they are source of our well-being. Namaste. Himalayas are like our head for Bharat Mata, and it is the pride of our continent, our planet Earth. We need to protect Himalayas. The glaciers are melting today. Environmental conditions are really need attention. Himalayas are the source of many rivers for our country, and we have to see that the rivers are kept clean and pure. Tourism should be developed, but not at the cost of environment. We can do a lot to educate, to protect and to grow the biodiversity in the Himalayan region. Let's all join together and make this Himalayan project a big success. Himalayas are sacred to us and they are source of our well-being. Namaste. And Himalayas are like our head for Bharat Mata, and it is the pride of our continent, our planet Earth. We need to protect Himalayas. The glaciers are melting today, environmental conditions are really need attention. Himalayas are the source of many rivers for our country, and we have to see that the rivers are kept clean and pure. Tourism should be developed, but not at the cost of environment. We can do a lot to educate, to protect and to grow the biodiversity in the Himalayan region. Let's all join together and make this Himalayan project a big success. Himalayas are sacred to us and they are source of our well-being. Namaste.
And request Atul to go live now before Sunita starts.
It's live. Am I audible? Thank you. Very good evening, everyone. Welcome to the 5th webinar of our Himalay Chintan webinar series. Today's webinar is titled Voices of Himalaya, Echoes of Triumph. I am Sunita Arora, your moderator for today. We are thrilled to have you join us as we delve into the incredible stories and efforts that are shaping the future of the Himalayan region. Today, we have the privilege of hosting a distinguished guest, Dr. Pankaj Tewari, the Executive Director of the esteemed NGO Aarohi. Under Dr. Tewari's visionary leadership, Aarohi has launched numerous groundbreaking initiatives aimed at enhancing the quality of life for Himalayan communities. In this session, Dr. Tewari will take us through the inspiring journey of Aarohi. He will share the challenges they have faced, the strategies they have employed, and the triumphs they have celebrated. His insights promise to be not only informative, but also deeply inspiring. Before we dive into the story of Aarohi, let's also know a little about the background of our today's esteemed speaker, Dr. Tewari. He holds a doctorate in forestry and environment science and has over 2 decades of experience in environmental research, sustainable mountain development, and livelihood security for rural communities. Dr. Tewari has led over 21 projects for national and international development agencies, including IC Mode, World Bank, and UNDP. His scholarly contributions include 34 research papers and numerous articles on climate change and sustainable livelihood. Dr. Tewari has been recognized with several accolades, including the Certificate of Excellence for his work in watershed development and being named a climate change leader by LEAD India. His dedication to advocacy and training has made a significant impact, and his expertise spans natural resource management, community health, child education, and sustainable livelihood. So without further ado, please join me in extending a heartfelt welcome to Dr. Pankaj Tewari. Over to you, Dr. Tewari. Our audience is eager to hear you. Thank you.
Thank you, Anju-ji, and thanks, first of all, thanks to Sunita-ji, you, and especially the platform of because this is an opportunity for Aarohi to share our works with all of you. And ultimately, through this platform, we will be able to share our stories and also looking forward how we can collaborate and to basically replicate our works across the Himalayan region. That will be one of the outcome of this webinar. Thank you. Thanks again. And looking forward that how the things move forward. And I will be able to share what we are doing in the small area. So we are just trying to bring the change, especially in the life of the people, in context of the quality of life, rather than talking about one or two things over here. Thank you.
Sushmita, I would request you to kindly share the presentation.
Visible?
Yeah,
Yes.
it's visible.
So, Dr. Tewari, we would request you to take us through the Aarohi's journey through this presentation. Thank you.
Yeah, so Aarohi is one of the organization, you can say the one of the pioneer organization working in the mountains, specifically in Uttarakhand state since 1992. So, and we are the organization, we are based in rural settings. So we are not in the towns, we are in the village, and basically 3 villages, which is represented by 2 different legislative assembly in the area. And since 1992, it was our plan that how we should go forward. So our founder, Una, she was a very visionary lady, and she thought of the holistic approach of development since its inception. So Aarohi came into existence in 1992 with a way to work in all the sectors all together. It includes the health, education, livelihoods. So rather taking one concept, so today we can say that whatever Aarohi is working, so we are almost meeting all the SDG goals at a time. Almost out of 17, we can say we are directly working with more than 10 goals and also touching around 5 more goals. So almost 14 to 15 goals we are targeting. So it was not thought in 1992 or 2010, 12 that we are going to follow it, but it was a practical thing, what we have seen in the ground, that we are trying to basically work with the society in all. So in the way, we are working diverse sectors with the holistic approach of development in the mountains, especially to change the life of the people, especially to provide the quality living standards to the people. So by providing them all the different facilities over there. So almost we will be completing 32 years in August 2024. Can we have a next slide, please? So this is one how we are in the rural settings. So Aarohi always kept in mind that we should work in synergy and we should complement the nature rather than basically competing with the people or the nature. So we are working in close synergy with the environment, with the nature in this rural setting. You can see in the slide that where we are situated, where we are having the forest, those are still not very dense. Now we are working a lot on all this. So we are having our 𝗳𝗏𝗃𝗃 Kendra and lot of things all together. So our vision, since its inception, it was to create a more equitable society, because the challenge when the organization began its journey was that to how to create trust among the community. And in 1990s, the role of women or the women representation in different interventions was limited. So it was one of the biggest challenge for Aarohi, how to bring them into the mainstream and to work with them in development activities, especially the sustainable development activities. So it was thought to create a more equitable society, and our mission is still, which is right now, creating development opportunities for the people over there. So right now we are working directly with around 457 villages in Uttarakhand state, with around 5 districts of Kumaon. So we are not able to reach the pan Himalaya since we are operational since 1992. We have always attempted right now to create a model that could be replicated with the support of government and other partner organizations across the Himalayan region, that we are attempting right now. So we touch almost live of around 100,000 people directly right now for our interventions in different activities. So in that way, our outreach is with 457 villages, but that is good enough. At least if we are able to work in all our sectors like health, education, and livelihood, and even our NRM sector. So that's why we are working in, especially right now in the Kumaon region. But our future plan is that how we should work across the Himalayan region with our partners and with the government agencies. That is. So we are the organization. Aarohi is one of the organization in this area that works in close synergy and in close association with the government agencies. So we mostly complement the government program with our program, and we are also getting good support with the government agencies in terms of compliances, in terms of their support in implementing our programs, and also by the partners, as well as we are also getting a lot of support from the community. So the involvement of stakeholders is very much strong with us. It is right from the grassroots level and up to the top level. Next, please. So when we talk about our founder members, so like you see, that's late Una Sharma was a founder, while Dr. Sushil was the co-founder, and we were having the eminent members in our board when it was started. You can see all these people over here, and the Una was the lead or the mentor to initiate this organization, to bring this organization at the ground level. But unfortunately, one of the challenge for Aarohi was also that after 4 years of organization was established in 1996, she unfortunately died due to mushroom poisoning. And it was again a challenge that how Aarohi could move forward. Is Aarohi is not going to work further, or how to make it possible? Then co-founder and with the team of the local villagers and the well-wishers, we continued this journey with lot of ups and downs and transformation phases. And still we are continuing here with almost 150 of the team members directly involved with Aarohi, with around 95% of them are locals. They represent different villages around the organization offices, and with around 55% of the women representation in the organization. So this is one of our USP, and it has been never thought that we are working in this direction. So when we talk about one of the concept of government, Atmanirbhar Bharat, so already Aarohi is attempting since the last many years, or we can say last 1 or 2 decades, to create the opportunities for the locals for the job opportunity, for their upgradation of their skills, and also providing them the employment. So ultimately, somewhere taking care of, reduce, or to prevent the stress migration in the area, and to create all system intact in the area, because we follow one concept of 5J. That means Jan, Jangal, Jameen, Jan, or Janwars. Means we need the forest, we need water, we need even the wild animals or the animals, and we are equally important for that. But what happens in most of the cases, we the human being, we are generally dominating the things. Then the things get collapsed. So herein, we are attempting to work on the 5J concept, where all are interlinked, and how we could create a change among the lives of the people in the mountains and create a model that is one of our vision, or we can say one of our objective. So right now, existing board is also having numerous people with a visionary chairperson. Next slide, please. So we are having a chairperson right now, Colonel C.S. Pant, who is one of the eminent radiologists known for his work since 1980s, and he's been our chairperson and also the guiding person behind taking this organization further forward with all of us. So this is our existing board. You can see the different people over there. But yeah, the purpose is very clear. Aarohi focuses on 4 of the thematic areas. And one of the things we can say, that when we are working with the local peoples, we are working with the women, we are working with the local stakeholders, one thing is very clear, that we are working for the good of the people. And our intention is very clear, that how could we bring the change? Although there are a lot of challenges, there are a lot of, you can say, not only the challenges, but also lot of sometime you can say we are also facing a lot of resistance also from the different areas. But ultimately our purpose, that we could create a model in this area that could be applied across not only the Himalayan, but across national level. Because when we talk about the health issues, when we talk about the education, almost those are common, although the hardship is more in the mountains rather than in the plain areas, in context of the accessibility specifically over here. So we are focusing on 4 of the thematic areas, and the 4 of the thematic areas with us are the livelihood, the health, education, and also the NRM. This is in our next slide, if you can see there. So we focus on 4 of the things. So there may be many of the organizations those are working on various verticals, but Aarohi is one of the organizations since its inception. It has taken care of all 4 factors, especially the livelihoods, education, and that's why I'm talking about the things that we focus more on holistic development approach, or we talk about the change in the quality life of the people rather than making it only on 1 or 2 aspects. So when we talk about our health program is one of the unique program. And this, you can say, this is the unique facility in this rural remote villages, where we work with one of our hospital known as Aarohi Aarohi. We are having a cottage hospital, 4-bedded. We are having one of the new initiative of Amrit Clinic, a maternity center in the Gram Panchayat. We are working with directly with the community on the various aspects of their health. And we are having the mobile medical unit. Mobile medical, next slide, please. So we offer various services through our cottage hospital, and you can see. So we are the 24/7 hospital in this area. Previous slide, if you can say. So we are the only hospital in this area that serves for 24 hours, 24/7. We are having the resident doctor. So you will not find such facilities almost in such a remote areas, where we are offering such services. We provide dental services, OPD, IPD, and we are the organization that is providing on their own as an organization the ultrasound facility in such remote areas. So we are having the path lab with all advanced tests over there. We are also having a state-of-art operation theater, where we do the surgeries on quarterly basis. We are having the physiotherapy department, and we also reach out with the various camps and home visits. So in that way, it's not very easy to take care of all these services, but with our young team of people, we are experienced professionals, we are able to provide these services in such remote areas. Next, please. So, but it's not easy to provide these services. So when we started in 1992, so we started with a very small hospital, and it was started with 1 or 2 rooms with some basic services. But with the time, we went in 2006. Next slide. There is the chronology how we have reached to such a state. So this was not easy. So in 1992, we started with a small hospital, but ultimately in 1997, we started the radiology sort of things over there. And this is the chronology you can see. So it's not very easy that wherever we are today, it's not a magic stick that we have reached out to this condition in a day or two or in a few years. So it's almost 30 years to reach out here. Although since 2017, 18, we have done our hard work to make it more advanced and to reach out to maximum of the people. And the one of the best thing is that in 2020, in 21, we were able to have the advanced diagnostic pathology lab with ECG services, while in 2020, we were able to become a 24/7 emergency services. And that is basically on the demand of the community, because we were knowing if we are able to not provide the services in our hospital, then people have to travel almost 3 hours from their places to the higher referral center. So today, at least we are very happy, and I am happy to share that today the emergency services almost in a month we are having almost 40 to 50 cases in the emergencies during the night or the odd hours. So this is, though maybe the number is less, but yes, even a one patient is very important if you are able to save the life of any one person. And then in 2023, we were the first ever organization in Uttarakhand that has started a maternity and health center in collaboration with the Gram Panchayat. It's the first type of model in Uttarakhand, the model of Amrit Clinic of Rajasthan, where we are operating such maternity center in a Gram Panchayat building, which was defunct, which was having no lights, no water, and it was remaining defunct. And today it is turning one of the successful maternity center, and it was initiated in 2023, and already the center is providing the regular services of OPD. Beside, safe deliveries has been done during this period there. So this is one of, otherwise again from that place people has to go a long way, around 4 to 5 hour journey for the further services. Next, please. So this is one of our, you can say, the unique thing that we are doing. And in, it's my pleasure to share with you that we are offering these services in close association with the district hospital department, CMO office, and also with the stakeholders and our well-wishers. So we do also the specialists in surgical camps time to time, and in which urology, gynecology, plastic surgery even we do in one of our surgical camp, and we do the general surgery also there. So these are very common feature from us. Next, please. So and we are having the collaboration with one of the ARSI, one of the Association of Surgical Association in 2017. So we get a lot of support, and you can see in the slide that we have completed 19 surgical camps, and of which around 500 that got benefited in last 15 years, so 10 years. So next slide, I will not go through it, it's long, but that yes, today we are having almost the OPD of around 35 patients every day in our cottage hospital, whereas in our another clinic, maternity center, it is around 4 to 5. So you can say that we are able to provide in a month around the support to around, you can say, 1,000 or 1,200 people every month from our center. Next, please. So, we are the organization. If you, this is one of the unique thing being done by Aarohi. Previous slide, if you can go. So we are the organization which operate mobile medical unit. This is the only, you can say, the unit which is equipped with ultrasound. You will not find moving ultrasound across India, in most of the cases. And you can just go through the timeline that this concept was initiated in 2002 by it's the brainchild of our chairperson, Colonel C.S. Pant Sahab, who initiated this in 2002. And the bus was inaugurated, the previous bus. The picture I am showing is the new one in 2020. But in 2002, it was inaugurated by late Abdul Kalam Sahab at Almora. So it was the brainchild of Colonel Dr. C.S. Pant. And how it came into emergence that the mountains, for the basic facilities, people have to move from one village to a nearest hospital. It took a lot of time and the money. So it was thought why we should not go to the people at their doorstep. So from there, the concept arises. It started in 2002 as a government program. In 2005, the National Rural Health Mission adopts the model, while then it was basically in 2012, it was not continued with the fund sources, but in 2014, because then the Colonel C.S. Pant was our chairperson. He took the lead, and we made an MOU with the state government. And since 2014, Aarohi is operating such mobile medical unit in the region. So we conduct a lot of camps in a month, and through those camps, we are able to screen almost around 600 to 700 patients every month in our 8 days camp, when this bus travels almost 600 kilometers with specific focus on the ANCs, as well as to find out the high risk pregnancies, and also to identify the surgeries those are needed to be done in coming time. Next slide, please. So this is again. So my point is that it's not very easy to achieve this. So we started somewhere in 2000 by the government. 2014, Aarohi took this initiative under our basically domain. And 2020, during the peak COVID period, we were having our new bus. So again, we took that time also as a challenge and utilized our time. And the bus was now the bus is covering almost 6 of Uttarakhand, is the Kumaon region, Almora and Nainital. While again in 2022, we started it in Almora, and we are planning to expand our services in coming years to some other adjacent districts also. So this is one of the unique facility, you can say. And this bus basically bridges the gap between our Aarohi Kendra, our rural hospital, and our community health program, wherein we are able to find a sort of patient for the surgeries, patient for need further care. So this is one of the USP where we are working, and this is the unique facility. I can claim this is the only facility which is equipped with ultrasound and moves to different places in this area. So then this MMU bus is also being basically we are having the human resource. We are having one physician, one gynecologist, a radiologist. There are the nurses, lab technician, pharmacists, and support staff. Especially during these camps, we are not only doing the ultrasound or the checkup of the patient, but also we are having the advanced lab facility. We test all the thyroid. Those are now turning a mandatory test, and the reports are being given immediately that time. So we are having the lab technician there and also the pharmacy there. Can I have the next slide, please? So, the focus area is especially is the maternal and child health, adolescent health, and geriatric. Next slide, please. Geriatric health. So we take care of all these things over there, and so it's the ultimate facility. So we are just planning. Next, it has been done. Yeah, so now with the government collaboration, we may be reaching out to more districts. That is a very advanced process. And you can see this is a state-of-art bus where we are having the separate things for all. The lab is in the different, lab is separated, the pharmacy is, all three are in the different pieces of bus. So all things goes parallelly during the checkup. It's not like that we are having. So again, this is the concept of our chairperson over there. Next, please. Then we are also working with the community, and while working with the community, we focus on the Women Health Resource Center concept, Why? Because in the rural areas, it's not very easy to work directly with the community from one place or for a central location. So we made it a very decentralized system where we are working with the Women Health Resource Center, which is headed by a nurse, and with the frontline workers. Those visit villages, take care of the mothers and the child or the pregnant women over there, and our focus is on that how could we take care of all the people community at their doorstep, and especially create the awareness to make them aware about their health, to avoid any mishappening. All those things is being taken care by our women health centers. So again, it's one of our specific, you can say, idea that we have launched. And again, this program is being supported by various CSR since its inception. And right now, we are also trying to break the various taboos over there through these Women Health Resource Center. And ultimate purpose of this whole 𝗳𝗀𝗃𝗃 is to reduce the or to basically minimize the mortality of the infants and all those things. And we are able to achieve such things somewhere in this region. And basically, when we are talking about the community health work, so we are not working in our area where we are more focused in this Ramgarh area. We are working in the remote villages of 𝗪𝗪𝗃 development block and the adjacent areas where the such facilities are very limited and they are having a best of option. They have to travel almost 100 kilometers to get the best, otherwise the facility. So it's the way that how we are working in the very remote areas. And one of our, with the health program, I would like to also share that how we also promote our frontline workers. Today, when we are talking about, can we go to the next slide? So when we talk about the human resource development, so we not only create the employment for the local people, but also we upgrade their skill time to time. Next slide, please. So just to share, this is in between. Today, when we talk about this, our clinic, maternity center in 𝗪𝗪𝗃, which we have started 2023, the two of the frontline worker, yeah, this one, just keep over here. So this is the picture of one of our this clinic that we have started for the first time. So this is basically an idea of the basic healthcare services in Udaipur that we have basically replicated over here. And this is basically a nurses-led center. So doctors provide them basically virtual support, as well as a weekly visit is being done by a professional doctor over there, but routine things are being done by the nurses. And I would like to happy to share with you the nurses. Those are basically providing all these services. They were initially the frontline worker with Aarohi. Then, based on their commitment, their willingness, they upgraded their skills and did the course of ANM and GNM. And today they are service again to their society. So Aarohi is not only creating opportunities for the job, but also upgrading the skills of the women and the young professionals over here, so they could serve further with better education and better skills in the area. Next, please. So then we are having a livelihood program with us. So wherein we claim ourselves a pioneer in the apricot oil in India. So we started in 1994, and how it started, just to share the story, we started livelihood means the apricot oil production in 1994, because in the year 1994, all the crop of this apricot got vanished due to the hail. So it was thought, what to do now? So it was thought, let's try something with kernels. And in the way, after a long sort of research or the hard work, today it has turned into one of our USP, that we are known for our wellness product as well as for our herbs and the infusion in the area. So that we started somewhere in 1994. Next slide, please. So again, everything has started somewhere. So is the story I am sharing all is of 32 years. So it's took a long time. So you can see here again the chronology. In 1992 we started with it. In 2001 we started the annual Grameen Himalayan, the unique program. In next slides I will share more on it. We launched the wellness project in 2003. And in 13, we started the youth wing programs. In 2014, we are the again organization that started the launch of rural homestay program in this region. In 2021, during the COVID period, rather than going into the hibernation, we thought of a program because reverse migration was going on. So we thought of the sustainable rural livelihood program to reduce the to utilize our agricultural land. Basically, most of the land was turning barren, and we started again. It's cultivable with the support of the various people. And in 2022, we started one more cooperative as a sister organization to initiate our livelihood project. So you can see, so we are having the apricot enterprise, we are having the herb growers enterprise with us, and almost you can say we are having more than 2,000 farmers working with us. Next, please. So then so sustainable, and you can see the unique. This is a picture of the ladies where you can find the years-old women, the experienced one, and the women, those are young. So it's the combination of both that how we are working at the ground level. So again, we launched a new what we can say the brand, or you can say the logo of 𝗳𝗃𝗃𝗵, with a logo of Himalayas and the oak leaf, the lifeline of the mountains. Next slide, please. And a range of products we launched through this cooperative. And why we kept two things distinct, our wellness and the herbal program and this agro product program. So to keep the integrity and to keep these two organizations, means our LPP program, livelihood production program, and our cooperative program intact, but on a separate mode, so to keep the identity of the program unique. So next, please. So in the next slide, you will see a unique this logo. You can see this is known as 𝗳𝗃𝗃𝗵, or you can say we are from the mountains with the oak leaf there and the Himalayas, and it's create the resilience among our farmers, and especially we are focusing on the climate resilient crops, because with the change in climate or the alteration in climate due to the a lot of damage due to the wild animals, we are thinking that how we could utilize the land in context of the niche local crops rather than just going for the European crops over there. This is one of the specific programs we launched in 2021, and I believe all this program are also supporting a lot of farmers, not only in this region but across the Kumaon region. Next, please. So through this program, we are directly covering more than 134 villages. We have formed more than 60 community-based organizations. I would just like to share here also. So we focus basically, women are the backbone of the mountains and everywhere. But herein we are also keeping intact the integrity and a synergy between the women and men. So when we call about the CBOs, these are almost a mixed groups with around 20 to 25% of male representation in these groups also. So we are directly benefiting more than 1,800 farmers with this, and we have a range of 60 products through our program right now. Next, please. So we are having a lot of networking partners that I will not discuss too much over here. So we are having a lot of partners, well-wishers there, those are supporting us. Next slide, please. So the Grameen Himalayan Art, this is a unique program that we have launched. Next slide, please. So all this we started somewhere in, can I have a next slide, please? So this is our unique program, the Grameen Himalayan Art, and I will just give you how it is originated in 2001. In the mountains, you found that previous slide, please. In the mountains, in general, what happens that Women are mostly involved with the house chore activities or to their day-to-day activities. So to provide them an option of sort of leisure time, and they could share and they could exchange their previous life piece. They could share their products. They could also have some fun time also with them. So we this program in between 𝗳𝗃𝗃 and Diwali period. So because after rainy season, women are also bit free from their collection of fodder activities and everything. So this has been kept an annual event during mostly in October in general, before Diwali and after 𝗳𝗃𝗃. So there's the time where they can enjoy the time as the cultural event, and we give this the name as our culture, our heritage name. It's basically a theme we give. So with a footfall of more than 35,000 people there, and almost around 25 to 30 SHGs come with their products across from the Uttarakhand areas. They share, they work with us, they exchange their program, and our school kids, our team perform their various cultural events. So it's a sort of a get together for joy. Next, please. Then we are the organization which has started the rural homestay program in this area in 2014. And today we can say we are happy to share that in 7 villages, there are more than 33 homestays. Those are basically accredited or registered with the tourism department. So, and Airbnb, they are getting good sort of support from the tourism department. And in the way, and all of our volunteers, those comes from different parts of India or from abroad, they are being basically ensured to stay in the homestays. So to be close with the nature, to be close with the society, and work in close synergy with Aarohi. So this is our one of the theme. Next, please. So beside that, one of the thing what we are trying to share is our education program. So when we talk about our education program, so it's a bit different program than the education. So it's the holistic development of the person in a joyful environment that we create in our school. So we started our high school in 1990. We started our 9th class and accredited and affiliated with Uttarakhand English medium for the 10th. So this we are working right now in the area. So this is one of our USP that we are working in all different sectors over there. And this school is from 4 students today. Next slide, please. So from 4 students now we are having 100. Can I next slide, please? So again, I said in 1994 with 4 children we started, and right now we caters around children from 3 remote villages with around the management committee of 19 members. Next, please. So, and our student teachers ratio, it is 1:9. You will not find such a thing. So why? Because we are not only focusing on the academics, but we are also focusing on the overall development of the child. We are having a library of more than 5,000 books with a specific librarian with us. We are having the music classes. We are having the internet connected 15 computers lab. We are having the digital smart board. We work on the craft and art and craft. We are very good with the sports in our school. So in all, we are having a different pedagogy we use, a contextualized syllabus we are using, and with more than 196 students, you can see. Next, please. So till date, 465 students have completed middle level education, with 284 girls graduated, 75 alumni placed in organized sectors. So this is, and also we also prepare the case for the competitive exams for the Sainik school and Jawahar Navodaya type of things. Next, please. So notable alumni, there are around 20. I have just shared in the slide 3 of them. So the Shubham Thapa, he's the personal chef at Ambani Residence Antillia. Jab is the self-employed yoga teacher, and Diksha Bhandari last 2 years back he received the gold medal from the president. So in a way, and I am happy to share with you around two of our, seven of our school alumni. They are now being employed with Aarohi. Our lab technician is our school student. Two of the nurses are our school student. One of the teacher is our student of our school, and one of our junior accountant, he is again from our school. So this is the way how we have worked. So but still again, there are a lot of challenges in each of every sectors. I am showing you the, what we can say, the positive note of our organization, because ultimately what we are doing good and what could be replicated across the Himalayan region, that I'm sharing over here. Next, please, slide. So challenges are a lot that I would. So in all, for a school, we can say generating, because we are not a school to gain the benefits, and almost around 55% of our students get the scholarship from our school, because they belong to the poor families. They belong to, especially we promote the girl child education in the area. Next, please. Can I have a next slide, please? Next, please. Next, please. So then, so these are the health education and livelihood program. So there is one of our program, sponsor a student program, where we seek support to support our student, and this is like that. We provide various support, and this is being supported by many of the well-wishers. Next, please. Next. So then we are also having the education outreach program, where we work with a close synergy with the government on remote and rural schools. This is especially focused on art-based pedagogy. And through this program, we are able to promote the para teachers in the region, the local youths, and also to sort of bring a change in overall teaching pedagogy in the primary schools in the region. Next, please. So right now we are working with almost 26 schools in the region, in 4 blocks of Nainital and Udham Singh Nagar districts, and again in Anganwadi's center. Next, please. So this is the way how we work. So this is the contextualized learning material that we use, apply in our schools. Next, please. So in natural resource management, again, I would like to share with you. Next, please. So in that way, I can say that Aarohi is working various. So we work on the CCBA program, Climate, Community, and Biodiversity Action. So since we are working since 1992 in the NRM activities, in 2020 we initiated a major flagship program in Aarohi to work with the one panchayats. And one panchayats only exist in Uttarakhand, in 11 districts of Uttarakhand. In Haridwar and Udham Singh Nagar, there are no one panchayats, and one panchayats are the legal entity. They are legally legalized since 1931. So we are working with the community, with the one panchayat, and this program is what we can say one of our ambitious program, where we are going to plant, next slide please, to cover around 1,000 hectare of area in all. So here I will just like to say before going to that slide. So we are directly working with 1,000 households, where we are providing them the water management and water harvesting methods. Then we have prepared a 2.5 kilometers drinking water pipeline, which is helping to more than 2,400 population. And not only we are going for this, basically having the pipeline, but also we focus on recharging our natural resources through means of various intervention there, especially creating the natural othermont, creating plantation in that region, and all those things, and using the GIS technique there to make it possible. So right now, when I'm talking about this 4,000 hectare area program, so we are working on 60 native forest species, not the exotic one. With 63 nurseries has been developed and 2,000 hectare area has been already mapped. We are working on 4,000 hectare area. Next slide, please. So through this program, we are working in almost 200, 300 villages. So this program will be for till 2032, and we are covering this much of area through this program. So plantation of 4 million plants in these one panchayats with the support of women and the local community. And all the species we selected based on the stakeholder consultation for 1 or 2 years and based on the need for the people. So because why people will basically take care or they will conserve the plants if they know that they will reap the benefits in the future. So that's why we have selected the species. Those are very important in context of the livelihood. And it is again a program which is being mapped with the GIS tech. So it's not like that. So basically it's a program that is linked with the carbon credit program. Next, please. So this is overall how we are working in the region. We are also working now with the entrepreneurship development, and wish that this whole presentation of around 45 minutes gave you the insight of Aarohi. So please join us, work with us, volunteer us, donate us, and hope to show you our joy. Again, I would just like to share with you the few slides. We have received this year only a 9th Astitva Samman from 𝗳𝗃𝗃 Chamber of Commerce and Industry in women empowerment. We received last year the program for the State Achiever Award for our health program, and we were selected as the 22 NGOs in 2022. So in that way, we are also getting bit recognition for the encouragement by getting these awards. And ultimately, we are thankful to our board, our chairperson, our well-wishers, the community, and specifically all our partners, the government, sir, because all they are basically supporting us, blessing us, and we are able to achieve all these things through their support. So next slide, just there are the few slides you can scroll. Those are basically about our academic collaboration, our partners with whom we are working in different areas. So just please scroll it, and is overall the presentation with that we are doing. So we are very bit now active also, and these are our school childrens. Those are basically involved with mostly with the local culture, but they are also being given exposure to have a wide range of their dances and the cultural activities across India. So thank you.
Thank you very much, Dr. Tewari, for such valuable insights and incredible work that Aarohi is doing in the Kumaon region. It's very, very inspiring. It's not just groundbreaking, but it's life-changing, and your commitment is really, really awe-inspiring. I would, as you would see from the feedback that we are already receiving in our chat box, this journey was extremely inspiring. I would open the floor for questions now, since a lot of them are already pouring in. So for audience, you can please type your questions in the chat box. Dr. Tewari, I would start asking right away some of the questions that have already come up. So first question has come from Mr. 𝗳𝗶𝗹𝗶𝗆. He's asking about the fees that is being charged for the services offered in the hospital and in the mobile medical unit. Is it like free or some fees charged for it? Would you please like to tell our audience about it?
Yes. First of all, thank you, Sunita ji, and all of you, especially Anju ji, visited us. So for providing this platform, and it's great to be the part of him. So his question is very right. So now we are not doing totally the charity. So sometimes what happens, I will share one of the example how we started to make it bit that we should charge something. one day a person came to the hospital, the BPL card. He was there with his car of duster, means the sedan car he was having, and he brought a BPL card and asked for the free of cost services. That day we gave. So later on, we thought, why we are going for the BPL card? So now we provide the services based on the minimal, what we get the charges. It is less than the government charges, and still around 40% of the patients are being waived off based on their financial condition. But yes, the people, those can pay, we are charging them. But again, the charges is not like that we are making it the corporate type of things. And still, I would just like to share with this platform, through these services, we are able to generate only 10% of our overall cost of our expenses for the hospital. So it's not like that we are charging very high. Like, for example, if we are charging, although around 35 to 40% of the patients are waived off, but even if our charges are like that, that we do the ultrasound at rupees 200 to 400 rupees, and that is the ultimate quality ultrasound. So in that matter, we are charging very low, and even about the medicine, we are more focusing on the generic medicine. It's not like that. So in that way, we are charging with the people, but not in a way that. So our one concept is very clear, Sunita ji, that neither we will get exploited ourselves, or neither we will exploit another, the people. So it's the way to win-win situation. So sometimes everything free doesn't also work. That we believe.
Absolutely. Yes, right. It should not be taken for granted.
Yeah.
Right. So another question, Dr. Tewari, that has come up is how the requirement of fund is being met. Are corporates also donating, or there are other donors? So that one question that has come.
So it's really a question that I was expecting. When we talk about the fund, basically financial thing, so around 35% are being basically 35 to 40% is being generated through CSR. Again, around 30 to 40% through our individual donation. That is one of our what we say the big support for the individual donor. They believe us, and especially due to, since Aarohi is its own brand, and people know that whatever they will donate, it will be utilized in the right direction. And we today, whoever are in this whole basically session, they should visit us, because I always say, please visit us and then take a call on us rather than we are making the presentation. That's we always ask. And I will be highly thankful to our chairperson, our board, because they are working very hard on fund generation and individual donation. So this is, and around 15 to 20% we are able to generate through our services. So 80% is still we are dependent on the CSR individual donation, while 20% we are able to generate. And that is very important also, because ultimately not today, at least after 20, 30, 40 years, either we are not in Aarohi, at least we have to continue the things over here. And one more thing I would just like to add, Sunita ji, please. Aarohi is one of the organizations that is not the individual organization that I would like to mention. Our founder, she died in 1996. Again, her soul is in the premises over here. That's why we are working. Then today, the whole board is working on. So you can't say who is basically leading this organization. Today, earlier, Dr. Sharma was there. Right now, Colonel C.S. Pant, he is basically taking a lead. And I am here as the executive director. Maybe in next 5-10 years, it may change, but the things will move forward, because we have to not only reach to this 460 villages, we want to work across Uttarakhand and with the partners across Himalayan region.
Right, right. I would also like to add to what you've already mentioned, that absolute transparency is being maintained in terms of funding. I was going through your annual report also, wherein the names of donors, the amount received, everything is mentioned very clearly there in the annual report.
We always believe if someone is giving us 1 rupee, so we could utilize fully 1 rupees, because they rely on us, they trust us. So we should basically ensure that money is ours, not of the donor.
Right, right. Another question, Dr. Tewari, that has come from Arya Pandey, and similar question has come from 𝗳𝗶𝗹𝗶𝗆 Margshala also. Arya is asking, what sectors does Aarohi provide employment, upskill the local people? And similar question that has come is, what kind of initiatives have been planned in the area of entrepreneurship by Aarohi?
when we talk about the 𝗳𝗶𝗹𝗶𝗆, so obviously 𝗲𝗂𝗃 is also one of our partner over there. So already, for example, we provide the entrepreneurship in terms of the employment. All sectors are open. It's education, it's livelihood, it's our health group. So where we build the skills of, for example, already one of our uh, frontline workers, she is pursuing right now A&M from Haldwani, and we are supporting. Similar, two of our teachers, they were not having the B.Ed. They are pursuing this. Two of our students are pursuing some other degrees. So that is one. While in context of the entrepreneurship development, so already last year, generally in the mountains, you will find generally people do not want to go for the barber shop or the such things. So we have created one couple over there who is now operating one of the barber shop and the beauty salon. While one of the entrepreneur, he is being developed last year as an electrician, and अभी हमारा नया स्कूल जो बना था, whole electricity fitting done by him. So in that way we are working, and fortunately I would just like to say with the PSG Chamber of Commerce and 𝗲𝗃𝗃𝗃 is also one of our partner. In coming year, might be we will be starting a vocational training program on school premises, especially on stitching, carpentry, मेसन, जो खत्म होता जा रहा है, वुड, जो आप पीछे मेरे देख रहे होंगे, जो मेसन का काम है वो लगभग खत्म हो गया, वो आज हम इसी नेचर के साथ रहते हैं. And also, especially on the electrician, plumbing, these all things we are taking care of in coming time. And in our school, we are going to go for the computers training in the evening after the school get closed for the youths there. So there are a lot of scope that is going on that we are planning.
Thank you. Thank you for sharing that. So, Dr. Tewari, one thing that comes to my mind is, I think which all of us somewhere are, thinking about this, that Himalaya is a very challenging terrain. So, it's very difficult to do the kind of work that you're doing there. I want to know what kind of challenges Aarohi faced, to evolve to this level, and how did you overcome them?
So major challenge we can say that is the aspiration of the youth right now. Because with the globalization, with having lot of communication and all of things as internet facility, the aspiration has been changed of the youth. They want to go to the cities, and keeping them intact in the village is a very tedious task. So sometimes we plan very good, but it is being not liked by the youth. So this is one of the biggest challenge. Even after working so hard, we are not able to prevent 100% migration. So right now we are focusing to prevent stress migration at least. So for that, what we are trying, especially we are focusing on to create entrepreneurship and to go for the end-to-end solution. When we are talking about the livelihood, so we are not just going for the trading and for the cultivation, but we are talking about the product development and income generation. Because if the farmers is not getting, or the person is not getting income from their activities in their field, so why he will go for such activity? So that is one of our things. And right now we are very much focusing on the soil health, because if soil health is going deteriorated, then our biodiversity will all not remain intact. And in the mountains, you can say that forest, agriculture, and livestock is the interlinked feature. So that we are attempting. And we are hopeful that by providing the education and health facility also, so we are trying to bring the change in the quality life of the people. So we are not talking about only livelihood, but we are talking about the making best of facilities. For example, again, it's a big challenge to continue the hospital. Bringing doctors to you to remote areas not easy. But yes, we are. So that again, all our team efforts, our chairman's efforts, how we are able to make it possible. So we asked doctors. One day, it was a case of there is one school for international training. The US-based student from rural, they come to our premises for 15 days. Abhi 21st June se aa rahe hain. So they said, how you are able to bring the doctors here? So I said, we sell Himalayas. So he said, how you can sell the Himalayas? I said, we do not sell Himalayas, but we asked them, please, now you have done a lot of work in the corporate, come over here, just enjoy the nature and work with us. So in that way, we are bringing the people. And only thing is that if your intention is good, then challenges को भी आप कम कर सकते हैं. That I believe, and our team believes.
Right, right. I must agree to this because हिमालयस में आपने हिमालय सेल करने की बात बोली तो 10-15 दिन घूमने के लिए तो आना सबको अच्छा लगता है हिमालय में but when you have to live in Himalayas and serve there, you know, we see how many doctors work in Himalayas only because of the government bond that they've signed. So that intention matters a lot with which you are working. That's very rightly you mentioned that. Dr. Tewari, another question that I want to ask is, as the executive director, you know, what has been your most rewarding experience working with Aarohi?
So my experiences, what I can say, because I am born and brought up in Nainital, so always have been working with close to the nature, and Nainital is known for as one of the best tourist destination. One of the, although right now it has been changed. So it was always in my mind after my education how we could continue the things. So after pursuing my PhD and working with some of the organization, I thought that there is a huge gap between science policy and practice. So what was happening that as a scientist, we are doing great jobs. We are having a great research being done. As a policymakers, lot of programs are coming. Community is working on their own. But we are not able to transform or translate the learnings at the ground level. So Aarohi gave me a platform where we can make it possible, where we are working on action research, whatever the research is going on, that is being applied in field. So, and Aarohi, and why we took the option of Aarohi, getting a lot of option in the urban centers, maybe in Delhi and something. Here it's also great to work with our own society. And one of the things I can say that make me very happy and our all team, because I am having a young professional from Mumbai, from Tamil Nadu, those are serving here for many years, along with our local team. So one of the things that in the morning, if I meet one of school student smiling, that give me a pleasure. And in the evening, if two patient goes happily from our hospital, it's give me a pleasure. And again, this Aarohi or such organization give you an opportunity for your own identity. Might be if you are working in some places in the corporate, maybe in that big cities, might be we are generating a lot of money. But here we are getting own recognition. And at the end of the day, if we are satisfied what we have done in the day, that's make us happy over here. And Aarohi is one of that platform for all the people.
Absolutely, absolutely. So, Dr. Tewari, one question that has come from the audience also. Looking ahead, you know, for let's say next decade, what are your priorities, your goals for Aarohi?
So already I would be happy to share with you that we are going to have in next 3-4 years our 10-bedded hospital here only, where we will be having the physiotherapy as a specific thing, ENT, and we are going to work on it immediately in next 2-3 months. So this 10-bedded hospital will be again from primary healthcare, we are going towards the secondary. Still, we will not go for the trauma things, but yes, that is one of the target. One of our target is that with the partners like Hum and all the partners in the platform of Hum, we would be very happy to reach out to the across Himalayan region through our success stories and through our experiences. So that could be expanded across the Himalayan region. That is next one of our target. One of our targets is that because we have worked a lot on Women Health Resource Center, through which we have learned a lot in last 10-15 years, and it ultimately has resulted into a maternity center in Gram Panchayat building. That would be some of more option that we will be expanding in the Himalayan region, especially in the Uttarakhand region. And to upgrade our school up to 12th will be another task in next 5-6 years for us. So we have to move forward. And ultimately, things are that whatever we are doing in this small area, means 500 villages, we would like, we will be very happy to expand our learnings, our livelihood programs across Himalayan region with the partners. Because we can't reach out to each and every place right now, maybe, but we wish in the partnership, I always believe 1 + 1 is equal to 11, not 2. We work on that theory.
Best wishes and more power to you on that.
Thank you.
So, Dr. Tewari, one question that I always ask my speakers on this platform is, Himalay Unnati Mission, this webinar series is not just an interaction platform, but it's also a policy advocacy platform, and you've also been involved in advocacy. So I wanted to know that as Himalay Unnati Mission, what suggestions we can communicate to policymakers that can help organizations like Aarohi?
So one is that how we could able to get, although we are complementing all the government program, but as an NGO, we feel that there are a lot of funds. Those are being with the government. How it could be best utilized through organizations like Aarohi or maybe many others. It could be one of the options to leverage the funds and to utilize the best. Because when we work at the ground level, so for the government, we are the best agency to effectively utilize all those things at the ground. Second, I believe right now there are a lot of compliances being held at different levels. So how we could make it more once we get the smooth for the organization to achieve. Sometimes it takes a lot of time to achieve. And thirdly, right now, one of the issues that is emerging in the mountains is the forest fires. You have heard a lot. And if we are not having overall the proper ecosystem services, then it will be very tough to keep the people who are here in the mountains. So there could be some sort of policy advocacy that we, Aarohi, as well as we all can do all together, that how we should avoid such things and how we should move towards the sustainable development in context of the biodiversity. Because somewhere in 1972 at Stockholm, it was thought about the Convention on Biodiversity Treaty. But still we are talking about. So there are a lot of things going on, but how we can make it possible practically at ground, that could be one of the what we can say the task or what we can do all together under the platform of the government.
Absolutely. These suggestions would be noted and taken care of. One interesting question has come from Mrs. Bahari. We want to know your take on traditional medicinal system.
So about the tradition that we have discussed. So when we talk about our hospital, so we are basically all the medicines are basically those are not the traditional one. But yes, we keep intact the traditional healers information with us. So they are never been neglected and they are the part of our program here. And with our some of the program like this plantation program, we are not only focusing on the tree plantation, but also we are working a lot on the medicinal and aromatic plants there. And also we try to bring the natural healers information intact with us. So they are also the part of our program.
Okay.
So we keep balance. It's not that we are just moving forward, but the indigenous traditional knowledge that we kept intact, because especially on the artisans, on the carpentry, we work hard work here. And still we are trying to basically keep intact that these dying cultures, traditions over here. So that is also our long-term one of our objectives.
Exactly. Himalayas are the treasure of this local knowledge, and we need to respect those
So
systems.
we many times focus on GI also.
Okay.
Geographical indication,
Yes.
like one of the species 𝗬𝗪 that is only found in 𝗵𝘃𝗿𝗆 across India-Nepal border. So that is one of the shea butter that is being used for soap making now already. So to make it into what we are doing, we are converting that oil into a soap. So ultimately, if income will be generated, then farmers will conserve the trees. And we focus on that. We have to not cut the tree. We have to just use the fruits and the leaves and the branches over there.
Thank you so much, Dr. Tewari. If I have a go ahead from Mrs. Bahari, should we move on to next part of our webinar? Okay. So, Dr. Tewari, I would request you to please stay with us for some more time. We have one more part of our webinar left, and I would be coming back to you again to ask few more questions, if any, remaining from our audience. Moving on to the next part of our webinar for today, there was one of our partners, Rainmatter Foundation, has come up with with an interesting concept of playbook. So we conducted a survey within our participants on how many people knew about this word. So very interestingly, only 18 people out of 96 had heard about this word. And on being asked that, whether they would like to create playbooks about solutions in their organization for others to use. So 37 said yes, and another 48 people said that they would need more information on it to decide. So we decided to invite our representative from Rainmatter Foundation to give us a brief about playbook. So Ms. Pranuti will be joining us to give a brief on playbook. She works as Senior Community Outreach Associate at Well Lab. She's a GIS and remote sensing expert by training and pivoted to community building on outreach after joining the development sector due to her inclination to know on-ground issues and try addressing them. Before joining the development sector, she worked with the drone UAV sector. She's currently working on the GRE, Green Rural Economy Initiative. So welcome, Pranuti ji. Invite you to discuss about the playbook concept. Thank you.
Yeah, thank you very much, Sunita ji, and thank you very much, Anju ji, for inviting me to this webinar. So it's also very interesting to look at the statistics as to how many people have responded, and out of which quite a few people actually know about the word playbook, but a lot of people are still interested in getting to know about the playbook. So I would consider this my privilege to present the GRE platform and the the project to so many partners of the Himalayan Unnati mission in the art of living. So I'll just and also I'm very sorry if it's a Thursday evening, and we are already, I think, I'm not sure about the timing of the webinar, but I would like to keep my presentation very short and crisp. And if you have any questions, we can take it post the presentation. Thank you. I need to share my screen, Sunita ji.
We'll make you the co-host. Sushmita, I would request you to please give co-host.
Yes. She can share the screen.
Yes, I can share it now. Is my screen visible?
Yes, it is visible.
Okay, great. So basically today I want to introduce all of you to the concept of green rural economy. And before I start, I would want to reiterate on a fact that green rural economy is not a project by, say, Well Labs or Rainmatter Foundation or any particular organization. But what we're trying to do is create a platform through a consortium effort. So the reason why we want to have this platform and what are we doing will follow in the coming slides. But green rural economy is basically a platform for knowledge discoverability, accessibility, scalability, and actionability. So why are we very consciously choosing all these four words will also follow. So for example, Tewari ji, thank you very much for your presentation earlier. I think that was very insightful, and the work that Aarohi has been doing is commendable. And I think it's an inspiration for people like all of us to kind of develop a platform like these, and make sure the knowledge and the repository of insights that you have through the 32 years of working in this sector, it would be really useful for us to take it forward from people like you to the other people in the community. So having said that, I will just start with my presentation. So basically, what is the context and problem statements that we have identified? So we realize that rural India is struggling with large-scale environmental degradation, and the income levels in rural India are also falling. Despite pumping in a lot of money through CSRs, through NGOs, the government is pumping in money. There's a lot of investment happening, but the rate of investment and the rate of change, they are not matching, and not at a rate at which it's sustainable. So here we had four observations that we could make. So what is the first observation is there are local innovations, but learnings and dissemination across the sector is very slow. So while we acknowledge that the development sector has a lot of innovations, and even the smallest of a CSO or a grassroots organization is doing beautiful work on ground. The problem here is basically the CSO or the organization is learning for themselves, but the dissemination across the sector is not happening because all of us are so used to working in silos. And I am really this is my privilege to be a part of this, because while I'm saying all of us are working in silos, this is a network. I can see 50 participants at the moment here, and this gives me great pleasure to see people who are really interested in working in a network mode. So I think the dissemination happens only when the learnings or the processes are documented. So here we have an example, there's a CSO in rural Maharashtra, which is implemented a concept of protective irrigation. So protective irrigation is something where, which is usually done in semi-arid areas where there's, very little to no water available during post monsoon. But still people want to go ahead with agriculture. So they try to give the little amount of water that is required for the crop to survive. So this is the concept of protective irrigation, and it's been done in a place in Maharashtra. But if something of that sort needs to be done in a place in Anantapur, which is in Andhra Pradesh, which is also a semi-arid area, I think the people don't have ways to transfer the data, or find ways to scale this up. So that is one of the observations that we had while we were doing the basic research for this process. And then CSOs, the second observation that we had was CSOs often focus on what we know and not we need. So a lot of CSOs have been working on specific intervention for around for the past 20-25 years, and they have been experts in that particular intervention sector, be it water resource management or natural resource management or something. But at a point, the area that they're working on, I think they will go beyond what what is the expertise of the CSO, and would require more themes that that we need to include, so that the area develops holistically. For example, a need assessment that the community needs help in backyard poultry maybe is what that is required for. But then the CSO wouldn't know whom to approach, or who do we call to make sure that we are given the right guidance. So the next question that we had is, how do we find ways to help the communities to get the help that they need, in terms of be it trainings or vendors, or any consultations, or any a hand-holding, capacity building, and things like that. So that is the second question that we had while we observed that we need, the focus is mostly on what we know and not on what we need. The third thing is basically solutions are often so contextual that it is very difficult to replicate. So that's the thing that we have been observing, basically before the translation of the solutions from one context to other, there's a need to understand the context. So there might be a solution that for example works in for example composting, or here, if, for example, pisciculture, that is very that works very well in humid areas, but in semi-arid areas there might be a different kind of a response for the same kind of ingredients or something that we put. For example, if you are trying to make a compost, okay, depending on the temperature of a place, the time it takes for the compost to be created, or the kind of ingredients, the percentage of the wet waste and the dry waste that needs to get in, all these will be different. The contextualizing of this solution is also something that is very important, and sometimes it's very, very tailor-made, that they can't replicate it in a different place. And then we also notice that the knowledge is fragmented, and because of the language and also the media. So for example, like we here it's mentioned, CSO in rural Telangana has put together detailed knowledge manuals and setting up backyard poultry. For example, Vasan is the organization who has detailed manuals on backyard poultry. But most of this knowledge is in Telugu, because the language that people of Telangana speak is Telugu, and they have contextualized it and made it for people in this local area to understand. However, if some of the other organizations, say for example in Karnataka, or say Jharkhand, or Orissa, want to replicate the backyard poultry, that is something which is difficult, because it's a new geography, and also the language that the document is made is different from the language that they speak in this area. So what we thought is, value addition is just one pathway to improving the livelihood in this area and improving the income. So the Green Rural Economy platform here offers knowledge on multiple livelihood improvement opportunities that can translate into improved income and sustainable environmental outcomes in rural India. So this is a very big statement to make, but what we're trying to do is, we are trying to look out for opportunities to make sure that people have the access to knowledge that is already existing, to make sure they're not reinventing the wheel. And then basically make sure the economy of rural India is improved. Just give me a second. Yeah. So how do we want to make sure that knowledge that is existing is accessible? Is basically we have segregated the platform into 4 different sections. One is called the playbooks. So this is the survey that we've conducted as to how many of you know what a playbook is. So basically a playbook is a how-to manual on various themes to enhance the rural livelihoods and the environment. So basically it gives a step-by-step process of how and what to do and at what time. We also try to make sure the timelines are mentioned, so that if a process is, needs to be done in a parallel way, or after a step-by-step manner, people know exactly what to do to get the achieved outcome. And also one thing that we realized while we were speaking with partners is there is knowledge which is available, but then after accessing the knowledge, some people are getting stuck at after reading the knowledge manuals that are available, they will have some doubts, and there's no one who can address these doubts. So that's when we have come up with a concept called as service directories, where we are also trying to add a few trainers and vendors associated with this particular playbook. For example, we are trying to create a playbook on bioresource center, where people are trying to create a concoction of 𝗳𝗶𝗹𝗶𝗶 or 𝗳𝗶𝗹𝗶𝗶. So basically the playbook gives us a step-by-step manual as to what should be the temperature, what should be the ratio of water and cow urine, and different things that actually go into the 𝗳𝗶𝗹𝗶𝗶. And also will also say this is the organization that has created this playbook, and if you have any doubts regarding the topic that has been discussed in the playbook, you can go and meet this person, or you can contact this person, so that you will know whom exactly to contact if you're stuck in a particular place of this process. That is one way to do it. And also vendor details, because for example, if they say you need a barrel of 25 liters, or say 150 liters, you might also try to see how are we finding these barrels, where do we find this, or what are the dimensions that are required. So vendor details in the local areas that they work in, so those kind of details are also something that we're trying to include. After this, what we realized is events is something which is important, and I feel lucky to be partner a partner of Himalayan Unnati mission, and hence I got to know about a webinar that's happening like this. Had I not been a partner to the Himalayan Unnati mission, I would have missed the presentation by Aarohi, and wouldn't have actually known what is actually happening, and all the beautiful insights that we got through this presentation. So what we're trying to do is curate a place where events around different themes that we plan to have on the platform can be enlisted on this platform, so that if there is an organization in a particular geography interested in knowing what are the other things that they can work on, so if they want to expand, for example, we had an organization working in Rajasthan in the water management sector. They are pioneers in the water management sector, but they wanted to also expand their area of expertise from water management, and want to also work in the livelihood sector. So that's when an event that we knew, so we kind of put them in touch with an organization that we know, which works in Maharashtra, who works really well in identifying the livelihoods, and they know how to train people on what livelihood that these people need to adopt as a community and all that. So they are so that event, so because we knew that there's an event happening, and we could put in touch these two organizations, they are now collaborating and exchanging a lot of value. So that's the reason we also want to make sure we want to host the kind of events that are available, be it paid, unpaid, online, offline, hybrid, anything, so that people know that there's some event happening, and if they're interested, they will contact the organizers and continue the collaboration from there on. And the last thing that we want to add to the platform is something called as forums. And we really feel forum is something which is really important to this platform, because while we would love to have the information all around the world on the on the platform. We also would like to acknowledge that it's practically impossible to have every solution from every organization to be on the platform. So there might be a chance that an organization is looking for a particular solution but is not able to find the solution on the platform at the moment. So once the traction is built for the platform, what we would like to do is we would like to have a forum where a person or the organization representative can post a question. This is something which we are envisaging, something similar to ResearchGate, where researchers, if they have a question or like they're stuck in some point, they post a question on ResearchGate, and the other researchers and the research community comes together. They answer the question. They try to if they have an answer, they will say, oh, in our area we have tried this alternative, maybe you can try something similar. Or if none of them have an answer, they can also come together, brainstorm, and try to see what is the best possible way to circumvent this issue and go forward. So that is the reason we want to have a forum, to make sure that once the traction is built around the platform, if there are solutions that are not already up on the platform, we can have a forum where there can be open discussions happening about problem that a particular organization or a person is facing in a particular geography. So like I already said, Green Rule Economy is a consortium-led initiative, because having given the presentation about what are we what the vision is and what is the kind of reach that we want for Green Rule Economy, we understand it's something very ambitious, and we actually need to work in a collaborative mode, and and we need to partner with organizations, and that is precisely a reason why we wanted to kind of introduce the concept of GRE and playbooks today in this forum. So what is the value proposition that this digital platform includes is, we are trying to make sure this is co-created with users and for users. For example, we have an organization called 𝗳𝗶𝗹𝗶𝗆 Sangh from Rajasthan. They are the people who are really well versed in the water sector. So they might be the people who are giving us the information on how do we create a build a check dam, or how do we make sure rainwater harvesting is done in the right way and all that. But at the same time, they can also be the organization who's looking for a solution of a different theme. For example, the livelihoods that we were talking about. So if they are looking at how can we create a community-based livelihood in the area that they're working, they can look for a solution that is already available. So here there is the user itself. So it's basically they are the people who are giving the knowledge in a particular theme and also taking the knowledge from a different theme. So basically it's very user-centric, and we also want to make sure the knowledge is contextualized, but at the same time the context is also specified, so that people are aware of where this works and where this might not work, and what can be the small tweaks that these people can do, so that this particular solution can be contextualized even in their particular geography. And we also want to make sure there are multiple languages and medium. And while medium, we mean, so we want to make sure there's audio books, we want to make sure there's videos that are available, we want to make sure there are PPTs, there are flip books, there are handbooks. So we want to make sure to create a plethora of options there, so that people can pick and choose and kind of take a very conscious and an informed decision. And the other thing that we would also like to highlight is, we want to make sure the knowledge is linked. So it's just not knowledge, but it's also actionable knowledge. And when we are saying actionable knowledge, we mean it is actionable because if you are stuck at some point, we want to make sure you have the resources, the right kind of resources, to approach someone who has already done something like this, or done something similar in a different terrain or in a different geography, who can handhold you from the starting of the process to the end of the process and make sure you realize your goal. So this is the value proposition that we bring. And what are the user types that we were looking at is basically CSOs. So be it the executives, the EDs, executive directors of the CSO, the coordinators, the mid-level management people, field staffs, and anyone. And collectives such as FPOs and SHGs, extension workers like the CRPs of the CSOs, and Krishi Sakhis of NRLM and SRLMs. We also looking at trainers in terms of basically they can expand their knowledge. They can learn from a different geography and also train the people in that particular geography that they work in. At the same time, also put themselves out there on the platform, saying these are the things that we are experts in, and if you need any training in this particular sector, we are here. And then service providers, basically the vendors and other people. So this is a very brief presentation that I had for you, and basically I think the way I would like to look at it is, basically this is only a brief introduction of what GRE is and what is like a bird's eye view of what we want to achieve through this. But what I would like to request of all of you is, basically, if you have any questions, please feel free to ask us the questions. And the other thing is, if you're interested, we will coordinate through Anjuji and Himalayan Unnati mission, and try to understand if any of you would like to know more about this the process of how did we build the platform, and what is the process in which you can contribute to the platform and also benefit from the platform. We would be great, we would like to organize some playbook webinars where, if you have some solutions that you would like to put on the platform, we would love to create a webinar where we try to handhold you to the process of creation of a playbook in the first phase, and then later on, you can go ahead and create your own playbooks, and we have a template for playbook creation as such, and you can go ahead and host it on the platform. And also basically would love to understand if there's any collaboration opportunities here. So with that, I would like to
Thank you.
stop
Thank
and
you. Thank you very much, Lakshmi Pranutiji, for an insightful presentation. I would put it very briefly. In my understanding, you are bringing structure and science to sociology. So thank you for that insightful presentation. I'm sure many of our audience have heard about it and understood about this term for the first time, and they would like to come back to you for further details. Thank you very much. So coming back to Dr. Tewari again, since we are quite, in fact, overshot the time. So one last question for Dr. Tewari, if our host can please spotlight, sir. Okay. Dr. Tewari, many of our interns from prestigious institutes like IIM Jammu have also joined us today, and there are many socially sensitive people who want to work for rural development sector, for non-profits like yours. So my last question to you is, what would be your message for such young professionals who are interested in rural development and social sector?
So again, that earlier also I shared that there is always a gap between science policy and practice. So if you want to bridge this gap, so for the young professionals and what we can say the youths, I would request that they should at least take out some time to work at the grassroots level. Then only I think they will be complete, their study or their education will get complete. Otherwise, sometimes we work superficially, so we are not able to know what is going at the ground. For example, if you are having a very good research work, if it is being not converted into action for the people, you can't do anything. So we have to realize that we should go to the field. For example, I am giving you the example, the team we are having. There are a lot of professionals who are from the biomedical engineering background from various states. They are coming here and they are now totally involved with this organization, because now they know, yes, here we are having an opportunity. So sometimes we have to think on this, that how much we are contributing to the society. Because what is happening with the time, it is happening that we are in a rush, especially our youths are in a rush that they want to achieve everything in a fraction of time. But I believe we should be slow but steady. We should not react. We should be responsive. So that we have to take care. And I still believe if they are able to join organization like Aarohi, not for the full time, maybe for 3 months, 6 months. I will just give you example. We were having one of the volunteer. Later on, she served Aarohi for 5 years. We are having one volunteers. She came during COVID just for 3 months. Still, she is providing us as a communication expert and the legal advisor for us. So point is that till you are not able to know the ground realities, you are not perfect. So if you want to become a perfect person in your life, you must join organization like Aarohi work in the field and know the facts and figures from the ground. So that is very important. At least वो experience लेना जरूरी है ना. हाथों हाथ अगर आप सीख सकते हैं तभी आपको कुछ समझ में आएगा, नहीं तो अदरवाइज. मैं आपको एक एग्जांपल देता हूँ. I can't name him. So एक I was the part of one of the thesis of one of the guy. उसने इतना बढ़िया प्रेजेंटेशन किया कि we thought wow, 4 पेपर थे, इम्पैक्ट फैक्टर भी बहुत अच्छा था. So at the end I asked him, how many times you visited your project site? He said, I never went to my thesis site. So then that thesis was holded for 1 year, and it was on the Gomukh, from where Ganges originate. So point is that वो तब तक अपनापन आना अगर आपको लाइफ में लाना है, सो आपको उस चीज को फील करना. सो दैट इज वन ऑफ माय मैसेज टू द यंग प्रोफेशनल एंड स्टूडेंट कि आप जब तक का जमीन तक नहीं जाएंगे तब तक आप उतना क्लोज सच्चाई से नहीं जुड़ पाएंगे, जो एक बहुत जरूरी है. और जो हम सब लोग आज हैं, ऐसा नहीं कि हम लोगों ने किया, बल्कि वो जमीन में रह के. और हमेशा हम लोगों को ये समझना चाहिए कि वो जो नॉलेज आपको ग्राउंड से मिलेगी वो कहीं नहीं मिलेगी. एक और एग्जांपल देता हूँ जस्ट लास्ट. एक बार हम एक स्टडी कर रहे थे फॉर स्टेट एक्शन प्लान फॉर क्लाइमेट चेंज. तो एक अराउंड 45 ईयर लेडी से हमने एक सवाल पूछा था अबाउट द क्लाइमेट चेंज एंड द एग्रीकल्चर प्रोडक्शन. वही हमने यूनिवर्सिटी के एक प्रोफेसर से पूछा. जब दोनों को मैच कर रहे थे तो एक ही बात कह रहे थे. तो फिर बात, ये यहाँ से 8 साल पुरानी बात है, तो हम वापस उस महिला के पास गए एंड शी वाज जस्ट 10th पास. तो कहने लगी, बेटा आप लोगों को बस इतना बताना चाहूंगी कि साइंटिस्ट है सबको और आपको तो पैसे मिल जाते हैं, हमारी रोजी रोटी है, तो हमसे ज्यादा इसका ख्याल कोई नहीं. सो पॉइंट इज दैट वी हैव टू रिस्पेक्ट देयर नॉलेज, और उसको हम कैसे उसको हम कन्वर्ट कर पाए इनटू रिसर्च, वो बहुत इंपॉर्टेंट है. तो जिससे उसके पीछे एक वैलिडेशन हो. सो आई अगेन से कि अगर आपके 5 साल अगर हम पढ़ाई कर रहे हैं हायर स्टडीज, तो कम से कम 6 महीने अगर हम फील्ड में देंगे तो शायद हम कुछ बहुत कुछ गेन कर लेंगे 6 मंथ.
Absolutely, that was a very very valuable message. अखाड़े में उतरना होगा, किताबें पढ़ने से सिर्फ नहीं होगा. Thank
नहीं
you,
होगा.
Dr. Tewari, for that very very enriching session. Now, since we've already overshot the time, I would invite our Chief Advisor, retired Air Marshal Rana sir, to deliver the vote of thanks. Over to you, sir. Sir, would request you to unmute your mic.
You can unmute yourself, sir. Please unmute.
Okay, now I do. Okay, thank you so much. You've just for letting me speak now. Okay, first of all, a wonderful webinar this has been. So I'll start with Dr. Pankaj Tewari. You are doing what I always wanted to do, and you are, this is really wonderful, and it's a great insight. There's nothing like being on the ground, and you are the perfect mix of the knowledge and the action, and that to action on ground. Aarohi is doing absolutely what Hum intends to do with a little bigger geography. You are almost picking up all the right work for us. So it is very wonderful to listen. You said, and I'm happy all our listeners today was so happy. I could see the boxes, the appreciation coming in the chat boxes. So that shows how interesting they were and how impressed they were by the long journey of your organization. And since I come from the same soil, I understand what are the difficulties to take the work, and how challenging it is to actually do any work in the geographies. So thank you so much for a wonderful presentation. Next is Pranati. It was really wonderful. It actually needed a complete webinar for yourself. It was you came in as this thing, but it's a good idea that you gave that we should actually do a playbook webinar by itself. It was a wonderful to know that how networking can help in today's world, and the wonderful idea of green whole economy. Of course, we've been working together on this, and we do not thank us for providing us a platform. It is the Rainmatter Foundation which has given us this platform. So thank you to Rainmatter Foundation actually to be able to make Hum do what we are doing today. And getting all the partners, all the people along. We also intend to do the same, providing that platform to be the voice for everybody across the region. And we are again showing us path of the power of the networking through this kind of platform. So thank you very much. It has been a really wonderful site, and I'm sure Ranjuji will work on that to have a dedicated webinar on Facebook and all your knowledge sharing. Obviously, it's a good idea that we should not be reinventing wheel every time. We already have this knowledge, and we can actually improve on that existing knowledge rather than another on the list for big thanks is Atulji from SMS. Support, and it is by partners like that we are able to and of course, Sunita, you become the professional really doing it so wonderfully well. With every webinar, you are becoming more and more professional, and very thank you very much for conducting.
I think somebody else's mic is open, Sushmita. Can you please check because the audio is not clear? Rana sir, please go ahead. थोड़ा सा audio थोड़ा सा unclear है.
There's some
So,
voice from the background. Yeah, now it's
yeah.
okay.
Yeah.
So, Anita, thank you so much for that wonderful and professional conduct. Very well conducted. Anjuji, of course, has been our backbone for this all along. And I must say, with every webinar, our standards are getting higher. One point that I wanted to tell Pankaj also on the policy and advocacy, that we do follow up these webinars by making the concept notes and the detailed notes on the subject, and share it with all the agencies who can make the difference, including the government agencies. So that is one of the better approach that we have. So these webinars don't end here after we have spoken, but we do take it to all our people and all the government agencies to take it forward and make sure that our voices are heard. Then at the back end, Susmita, again, you've been a great help. Doing a webinar is not easy. We almost, when we are doing at this level, there's a work almost of 1 month which goes behind. And also the Shamik and Sunita both have been working at it along with Anjuji and Sunita ji, and also our entire Hum team. We've been working at it. But bigger thanks, I will leave it for our interns and volunteers who make sure that we are heard. Our interns, particularly this time around, they have joined us and they've really made a lot of efforts. A lot of this work which goes on the background is assisted by our interns. They help us in social media. They help us in approaching and networking. And I would request them that they should continue to do this even when they are not working with us. Some of them would be working with us for a shorter time, but for to them, I would request that Hum would always remain your family, and it would always enhance your knowledge. So every time we come out with a webinar, it is with a lot of intent. It is it has a lot of knowledge value in it, and I'm sure every time you join us, it will be good to your own cause. And a bigger thanks to all our partners. We are growing. We are now 100 plus, 103 to be precise right now, and we continue to grow. Idea is that when we work together, we always work better. And we all are working with similar intent. You heard what Pankaj said. You heard what Praniti said. Everybody is talking about a partnership. Everybody is talking about a networking. Everybody is talking about the holding hands. So let us all do it together and let us provide that strength to each other. So once again, thank you so much, everybody. And in case I missed anybody, thank you to them as well. So thank you so much. Over to you.
Sir. Thank you, sir. Thank you to our audience. Thank you for joining us today. We hope you found this session as enlightening as we did. Let's continue to support and amplify the voices and efforts that are making a difference in the Himalayas. That concludes our webinar. Have a wonderful day. Namaste.
Thank you. Thank you, everyone.